induction program held with the theme How to Plan Experimental Methodology in Pharmaceutical Research. It's our privilege to welcome all dignitaries of today's session. Professor Vijay Bhalla from Principal in SGT University, Gurugram, Haryana. Professor Dr. Rohit, Dean, GD Goenka University, Gurugram. Dr. Kunal Nepali, Assistant Professor, Taipai Medical University, Taipai. And Dr. Kumar Gaurav, Principal, Guru Gobind Singh College of Pharmacy. I welcome you, sir. I also extend a heartfelt welcome to all the participants. For the first technical session, I would like to introduce Professor Vijay Bhalla, Principal, SGT College of Pharmacy, SGT University, Gurugram, Haryana. Vijay Bhalla presently working as Principal in SGT College of Pharmacy, SGT University, Gurugram, Haryana. He has passed Diploma in Pharmacy, Bachelor of Pharmacy, Master of Pharmacy from University of Delhi, and also secured Doctorate of Philosophy in Pharmacy. Professor Bhalla is a registered pharmacist since 1980 with Delhi State Pharmacy Council. Professor Bhalla has exposure of working for National AIDS Control Organization NACO in Delhi and Uttar Pradesh, project as Capacity Building Manager and Manager Operation. He has served with pharmaceutical multinational organization in various capacity for 18 years with Upjohn, Unicom, Saiba, Jiki, Sandoz, and Novartis. He has more than 10 years of expertise as faculty members with Dr. A.K. Abdul Kalam Technical University, affiliated educational institution imparting pharmacy education, and 5-year experience. And he has 5-year experience in the and he is 5-year experience, 10 years of experience as faculty member with Dr. A.K. Abdul Kalam Bhalla is more than 10 years of expertise faculty member and Technical University affiliated educational institute imparting pharmacy education and 5-year rich experience in developing all 5 departments in SGT College of Pharmacy. Professor Bhalla is a nominated trainer to pharmacist for Director of Health Service NCT. He is in office bearer for the last 5 terms, chair and members, Confederation of Indian Industry CII, Northern Reserve Committees on Life Sciences and Biotech, headquarter Panchkula. He has his Pharma Personality awarded by the Nirali Prakashan in 2021, most active member of UNESCO Bioethics Committee, SGT University in 2019, and Excellence Award Best in Recognition by SGT University on Teachers' Day at SGT University in 2018. He has been awarded by IPGA Fellowship Award 2013 and IPGA Professional Excellence Award 2014. He has guided many M.Pharmacy and PhD students and published good articles in reputed journal and is editor of IPGA. Today, Professor Bhalla has organized many national conferences and participates in more than 60 national conferences as chairperson and resource person. He has received financial grant from Haryana State Council for Science and Technology, Chandigarh, and SARB BST Chandigarh and PSC for conducting PCI for conduct of National Conference and Faculty Development Program. He is a life member of FIP, IPGA, IPA, IHPA, APTI, and attend FIP at AICTE University, Malaysia. Welcome, sir.
Thank you, Dr. Prerna. Pleasure
sir,
to hear.
Please address the participants.
Sure. I would like to share my screen, Prerna, first.
Yes, sir.
Am I audible?
Yes, sir, you are audible.
Is my screen now visible?
Yes, sir, your screen is visible.
Oh, great. So good morning to all, one and all. In fact, I'm thoroughly grateful to the management of Guru Gobind Singh College of Pharmacy as well the principal Kumar Gaurav and other faculty member, Dr. Ashwini, for including my name also to the 6 days online AICTE-ISTE induction cum refresher program on how to plan experimental methodology in pharmaceuticals research. In fact, I'm really delighted to see a big name in the panel. So I'm very happy to be part of this particular program. And definitely, I would also like to share my experiences also with learned faculty members of, and I understand all across the country. So I chose a very different topic today. I think people have been talking about fundamental and very aggressive research. And I thought, why not to give our slight different dimension, which I have experienced and which is a need of the day. So first, I would like to share that why these faculty development programs are essential in one's life. If we look at the faculty, they are the resources, human resources and leader. They have a vibrant and dynamic presence in the institute. They are face of the institute also. And in fact, they are the intellectual capital for any organization. They have a research driven presence and they have an ability to connect. So beside all these characteristics a faculty has, I understand their job functions. They are a teacher first, they are trainer also, they train also. They have to perform research because research becomes one of the assessing parameter for any of the faculty member these days. And they must also look into know-how transfer. This is what we call it a technology transfer or commercialization of any particular product. So if our research is going in the right direction and we are able to produce technology transfer or know-how transfer, then of course we are meeting the purpose of society. So if we look into the context, I have an opportunity to visit Guru Gobind Singh College of Pharmacy because in fact, I was born in Khizrabad village. So I have a special affection to Yamunanagar. So thanks to Dr. Gaurav. So Guru Gobind Singh College of Pharmacy's pioneer college is constantly evolving to the industry need, offering best quality professional education, and they are day by day. I think I've seen a very good infrastructure and laboratories and they are helping students for holistic development. And I can assure that this is one of the best pharma college in Haryana. So what I am going to talk today in my discussion and interaction. So I shall be talking purely a little about research, a little about pharmacists, more about public health. And of course, all these three domains, I think let's see what is the role of social pharmacy and pharmacy practice. So these are the very integral part. I think we should understand why I'm insisting on this particular domain or topic. Actually, I many a time I realized that the efforts which a pharmacist is doing and efforts as a front line worker, they are performing. None of the shop was closed throughout the pandemic, but still the recognition of the pharmacist is not to that level which we should really expect from the society or government. And if we see that pharmacist being a third largest population, not only in India, I think throughout the world. In our country, if we look, of course, after doctor, nurses are there, but pharmacists is still struggling to get that presence felt, which they really deserve. And one particular reason what I have analyzed, it is my pure perception, that I think we are not doing and creating papers in social pharmacy and pharmacy practice areas because we have a large chunk of population of 130 crore in our country, and if we start generating data and we start publishing it, I think even the policy makers, I think you can just see that after we have developed the vaccine, the perception of the pharmacist changed. I think we are getting good admissions also. So we should work in these areas for the benefit of society. Then I understand that a perception of a learned pharmacist is going to really increase manyfold. So as mild disclaimer, the opinion expressed in this presentation and on the following slides are solely those of the presenter, that is mine, and presentations are intended for educational purpose only and do not replace independent professional judgment. Attendees should note that the sessions are audio recorded and may be published in some of the following social medias. So today, let's start with public health. Let's understand what exactly is public health and where we place ourselves. So public health, adding colors to the life, basically. So to understand public health, let's understand health disparity in our country. There are a lot of health disparities and agenda. One reason is inequitable socio-economic development. We have a poorer section also, we have a richer section also. There are a differing rate of demographies. If we see our culture throughout the country and distribution, epidemiological transition is also there in disease pattern. It also varies area to area. Filariasis is more common in Jharkhand and Bihar side, but it is not common in western side. Emergence of infectious disease is another creating disparity. Prevalence of non-communicable disease, and now aging population is increasing day by day. So these are some disparities and agenda of public health, and the diverse challenges pose threat to achieving target. So concerted efforts and dedicated research are still falling short of targets in these areas. So there is a need of one healthcare practitioner and pharmacist as a third largest healthcare professional group interact directly with the public to provide health information and advice on the safe and rational and responsible use of the medications. So if we look into the process, how our country, we work basically for public health. So there should be an equitable, fair and impartial policies. There should be a resilient, able to withstand and recover quickly from the difficult conditions like pandemic we did, and efficient, able and potential role. So these three roles are very important. And if we see we have lot of domains, population need, health needs and expectation. So we have to check what are the unmet needs of the population. We have to look into the policies, governance also, and even non-health sectors, how those governance would affect our health also. We should look at the platforms, what are the accessibility of platforms and organizations who are caring for health. What is the workforce working under this? What is their number? What is their skill and how they are supporting it? And what tools we use? Being a pharmacist, we use medicine and data and some equipments. Of course, now medical devices becomes an integral part of the drugs. So in all these domains, we are continuously learning and improving for the people, because we are in a process of patient care, and competent care and system development is our responsibility. We should leave a quality impact for better health, confidence in the system, and of course affordability or economic benefit until unless will not show. Like Jan Aushadhi Kendras, one benefit has been shown. I think it is transforming. Many generic companies are coming. Yesterday only there was a report that even L&T Metro in Hyderabad is starting chain of pharmacies at every metro station. So look, economic benefit, we are trying to pass it on to the public. So what is public health? Public health meaning is protecting and improving health, promoting healthy lifestyle, researching disease and injury prevention, detecting, preventing and responding to the infectious diseases, protecting health of entire population, and promoting healthcare equity, that is fair and impartial, quality and accessibility. So this is public health basically. And of course, if you look, pharmacist is working in almost all the domains here in public health. If we see who are the basically professionals involved in public health, There are two domains. One is a clinical professional, others are the healthcare professional. Still, under clinical professional, you will find doctors and nurses are there because they're focused primarily on treating individuals after they become sick or injured. We are still part of healthcare professionals as a pharmacist. Even some NGOs are working in these directions, non-government organizations, because they prevent problem from happening or recurring by education, research, making policy and providing services. So our role should be, we should do a lot of publication and help generating data so that we also become, I think the PharmD program, Doctor of Pharmacy is gradually coming up, and a role in the clinical professionals is being established. It is yet to be established fully. Then if we look at the key functions in public health, the key functions in public health is providing safe food and water to the public. And we have a FSSAI standards, Food Safety Standard Authority of India. And we have to help people to avoid leading cause of deaths. Heart disease, stroke, diabetes, cancer, they are the leading cause of deaths. So how we can reduce the number of these leading causes of deaths, and then to reduce threat to the nation's health. There can be a pandemics also, and there can be other reasons also, like corona was one such reason, and substance abuse is another such reason, which is very predominant in our country. And I think this threat is to be checked, and the role of pharmacists cannot be ignored in these areas also. So if we see how we can do all this, we have to discover pattern of disease and respond. Like we discovered the genetic modification and we could create Covaxin in our country. I think that is one of the key role of pharmacists or scientists. Malaria, dengue, chikungunya, drug-resistant tuberculosis, leprosy, high maternal child mortality, HIV, COVID, these are the diseases where we have to look into. Monitoring health informed decision maker. So if we generate data, we monitor these health, we can really talk to the policy maker to draft national health programs in accordance. Like rising burden of chronic non-communicable diseases like hypertension, diabetes, obesity, increasing elderly population, and even environmental changes causing COPD, chronic obstructive pulmonary disease. I think these are another, we have to monitor them. So a lot of data is required in this direction also, how which drug is working, not working. Third is to train and guide state and local public health partners. We have to train. Training is one of the another role. So mental, neurological, and substance use disorders we can reduce by training. Rising road toll of road deaths and injuries we can definitely reduce. Even only tobacco attributable deaths are more than 8 lakh per year. So these are the areas where we can really educate the people and reduce the number of these areas. So role, if we see, so government is doing lot of things in this directions. We must be aware of that. They are investing in basic education, public health, and primary care. There is a lot of community participation, private sector and social societies are there. NGOs are working. They are being funded also by government. Living conditions, urban planning, revival of rural infrastructure. This is another function done by government. Nutritional and early child development, food and water security measures, and social security measures, population stabilization, gender mainstreaming, empowerment, reducing the impact of climate change and disaster on health. Government is doing many things. Other social assistance program like Aam Aadmi Bima Yojana. These are the few programs which our government has already undertaken. So if we look at the strategies taken by the government has a health system to strengthen national rural health mission. We have many pharmacists working under NRHM. Health information system, the integrated disease surveillance project is also there, where even a primary healthcare center are to report to the government what is the prevalence of that disease in that particular village or community. Health research systems are being developed, regulation and enforcement in health, public health, water quality monitoring, slaughterhouse hygiene, and food safety. Health promotion they are doing lot of programs, danger of tobacco smoking, promoting physical activity, TB Day, Heart Day, and etc. I think our pharmacists should celebrate all these days to make their presence in these areas also. Human resource development and capacity building is one another training. They have created one Public Health Foundation of India, PHFI, which is a positive step. I think many of us pharmacists can really join some of a very interesting courses on medical writing and other publication, as well as public health. The areas and domains they train very well. So then our policy is better health for all, if we look. So if we look at, even a WHO is supporting us in the terms of diet, eat right. Unhealthy diet and lack of physical activity is a leading global risk. So we have to protect against malnutrition of its all forms. The water required from beverages ranges from 30 to 60 ml per kg body mass. To avoid unhealthy weight gain, the fat intake should not exceed 30% of total energy intake, saturated fat less than 10%, and trans fat less than 1%. Sugar intake should be less than 10% of total energy intake, and less than 5% gives additional benefit. Salt intake to less than 5 gram per ml per day, and kyunki sodium intake less than 2 gram per day help to prevent hypertension, heart disease, and stroke. So energy intake calories should be balanced with the energy expenditure. So we see some of the problem areas which a government want us to address is a tuberculosis eradication. They have a program of tuberculosis elimination, preventive antimicrobial resistance. I think all of you would agree with me that antibiotic resistance is a gaining momentum, and lots of deaths are occurring just because of multi-organ failure, non-responsiveness of the antibiotics available. Stopping habit-forming drugs or drug abuses of benzodiazepine and other class of drugs, managing tobacco and alcohol abuse, controlling malnutrition, reducing sedentary lifestyle to prevent lifestyle disorders, and avoiding self-medication, so that we can dream of Swachh Bharat, Swasth Bharat, and Atmanirbhar Bharat in these areas. So how we can go for prevention and control? Half of the India's deaths are due to diabetes, stroke, heart disease, chronic obstructive pulmonary disease, cancer. This is a finding of Public Health Foundation of India. So could the collaboration between general practitioner and clinical pharmacists increase the safety and quality of care at primary healthcare level? Yes, we have to work towards this direction. What is the extent of spurious or counterfeit medication in India? Another question to think about. So pharmacists play a vital role in screening of various diseases like diabetes, hypertension, liver dysfunctions, immunization. So these are the areas where health education will definitely work. So now let's look at, we have a lot of type of research. So what basic and core element of research should be? So first of all, we must have a research interest. Many a time I understand, I have seen even our PG and PhD students are not taking up the research project which are really having interest in them. So they are sometimes forced to do like go for nanoparticles, go for this. So first of all, we have to look that what are their research interests. After extensive literature reviews, we must identify the gaps. And if those gaps are identified, we must look into the research methodology. We can design that methodology, and we finally conduct research, get the observation and finding, and we give directions for future researchers also. So that becomes a core element of any research. So I will not today talk about the laboratory research, because laboratory research has been talked by many people. So we will see non-laboratory research, what type of research we can really conduct. And our objective is research is for sharing. Research is for sharing, because if you will share the research in the publication, I think you will gain your H index, you will gain your citations, and those citations are going to improve your final credentials. So that is very important. So today I'll talking about some of the analytic studies where we can examine etiology and causal associations. And in that, We'll look into some observational studies which we can perform observations made without any interventions also, and with interventions. So in that areas, we can think of some cohort studies, case control studies, or cross-sectional studies. So I'll be talking a little about this. So if we look at the cross-sectional studies, what we do in cross-sectional studies, we look at the data from a population at one specific point in time. Like they can be observational in nature. They are also known as descriptive research, but not causal or relation. They are also known as cross-sectional analysis, transverse study, or prevalent studies. Many of the community medicine department in medical colleges and medical hospitals, they are working in these directions only and publishing their paper in a very reputed journals, where researchers observe the effect of risk factors or diagnostic tests or treatment or other intervention without trying to change who is or who is not exposed to it. So on these parameters, they basically perform the research. And healthcare scientists may use cross-sectional research to understand, for example, how children in the age of 2 to 12 across India are prone to calcium deficiency. This can be performed. So if we see the case control studies, in this condition, the two existing groups differing in outcomes are identified and compared. For example, the supposed causal attribute. Case control studies are often used to identify factors that may contribute to a medical condition by comparing subjects who have not condition or disease, जिनको वो disease या condition नहीं है, they are treated as a cases, and those who have those conditions or diseases otherwise similar, they are called controls. So case control studies can be there with exposed and non-exposed people. For example, very interesting paper was published, obesity and risk of myocardial infarction in more than 2,700 participants from 52 countries. This was published in a very reputed journal, a standardized case control study of AMI with 27,000 participants in 52 countries representing several major ethnic groups was assessed the relation between body mass index, waist and hip circumferences, and waist to hip ratio. What they found, waist to hip ratio shows a graded and highly significant association with myocardial infarction risk worldwide. So redefining of obesity based on waist to hip ratio instead of BMI increases the estimate of myocardial infarction attributable to obesity in most ethnic groups. So this case control study was performed. Similarly, there is a cohort study. What cohort studies is a type of research design that follows group of people over some particular time. Researchers use data from cohort studies to understand human health and the environmental and social factors that influences it. And in this case, over a period of time, we can go for an retrospective or historical data also, and we can give our observations. So in this study, look into one very interesting case, dairy consumption and risk of type 2 diabetes mellitus, a meta-analysis of cohort studies. Milk intake is widely recommended for a healthy diet. Epidemiological studies have suggested that consumption of dairy products may be associated with a reduction in type 2 diabetes mellitus. A meta-analysis was conducted to elucidate the association between dairy products consumption and type 2 diabetes mellitus. And what did they found? An inverse association of daily intake of dairy products, especially low-fat dairy, with type 2 diabetes mellitus was revealed, indicating a beneficial effect of dairy consumption in prevention of type 2. So this was one observation based on the historical data. For example, another very interesting case on cohort, laboratory-based versus non-laboratory based methods for assessment of cardiovascular disease risk. It was the National Health and Nutritional Examination Survey-based study. In this, what did they do? A method that uses non-laboratory based risk factor predicting cardiovascular events, as accurate as one that relied on laboratory based values. So this approach could simplify risk assessment in situation where laboratory testing is inconvenient or unavailable. So what this found, that a non-laboratory based method using BP level and treatment status, age, smoking status, body mass index, and history of diabetes yielded similar result that one uses laboratory testing. So आपने dyslipidemias और सारे cardiac test कराए और ये non health national health nutrition examination survey base पे non laboratory test से compare किया तो almost they were matchable. Similarly, a meta-analysis is a quantitative formal epidemiological study design used to systematically assess the result of previous research to derive conclusion about that body of research. जैसे बहुत interesting case है यहाँ पर vitamin C for the prevention of post-operative atrial fibrillation after cardiac surgery, a meta-analysis. Our first study was conducted in 2001 in USA, that 2 grams of vitamin C orally at night before 500 milligram, that is in 2 times for 5 days after surgery. एक टैबलेट सर्जरी से पहले और 5 दिन सर्जरी के बाद twice daily vitamin C अगर दी जाए 2 gram, so then you can see the effect on the cardiac surgery. So they found a very interesting result. The several studies have investigated the administration of vitamin C for the prevention of post-operative atrial fibrillation, and the findings suggest that vitamin C is effective as prophylactic for the prevention of post-operative atrial fibrillation. So it was suggested that administration of vitamin C may be considered in all patients undergoing cardiac surgery. So this is a good finding, a meta-analytical finding on the previous data. So this is very important part. So now let's see our erstwhile pharmacist. The prior to framing pharmacy practice regulation in 2015, the pharmacist responsibility were not defined except of dispensing and compounding medicine. So, but pharmacy is not a formulation and chemistry based subject only. So if we look at the pharmacy practice regulation 2015, we will see that they have added lot many responsibilities to the pharmacist. And there are 2 times even the word research comes. Research and health promotion, drug information, formulation of formulary in state and national level, physician and patient leaflets, designing, prescription handling in terms of assessment, safety, quality, efficacy, legality, documentation, duration, misuse potential, and label use or off-label use. Patient counseling in a special direction, common side effects, self-monitoring techniques, and recording. Even prescription auditing in terms of medication error and monitoring, digital record of drug administered, process and outcome research, rational and responsible use of medicine, enforcement of drug laws like Drug and Cosmetic Act and its rules. There are now 3 different rules in Drug and Cosmetic Act. We have a cosmetic rules separately, medical devices rules separately, and new drugs and clinical trials rules separately. So it has expanded the enforcement of drug laws. Pharmaceutical care like overuse, underuse, interaction, duplication. There is a trend of polytherapy these days. One patient goes to 10 different physicians or orthopedician or for multiple diseases. So they are prescribed sometime and overlapping and duplicate drugs also. So there we can really assess those. Public health, of course, has been included in this particular PPR 205. So what is the, you can say, the recent and agenda of today's pharmacist, yeah, pharmacist of the next decade? They are coming up is a direct public interaction, wide range of services, healthcare advisories, medicine information, therapeutic recommendations, directions and instructions, appropriate medications, correct use of medications. So pharmacist accessibility, extensive knowledge of drug therapy, and of course trustworthiness in the minds of consumer opens many opportunities for pharmacists to expand their reach into public health activities. For example, you have seen many a time our next door chemist or pharmacist, we trust more than a physician or doctor, because physician is able to give only 2 to 3 minutes in his chamber, but we can discuss for 10 to 20 minutes to a pharmacist. So we have a trust, and the trustworthiness of that pharmacist, you can really generate a lot of information from that. So there is, beside traditional role of pharmacist, if we think retailing and hospital setting में retail pharmacist or community pharmacist or hospital pharmacist, non-traditional role of pharmacist is also established these days, and that is a pharmacy administration in practice and education research. Importance of pharmacy is going to be patient-centered only in future come, and there is a role of precision medicine in coming time. So this is very important slide for all faculty members, with the added challenges of diminished funding for research and the pressure to publish paper and result by the institutions and organizations. These fields have to accommodate a much broader research framework than ever before. So this is an opportunity area for us. So if we look into these type of social and pharmacy practice research domains, an interesting observation and finding that 50% of the patient walk out of the physician office not knowing what they were told or they are supposed to do with the medicines they have been prescribed. So this is one of the interesting findings which can be worked on. So let's look at the unmet health needs. If we look at the distribution at lower end, like in poorer segment, if we see there is a malnutrition, there is a hygiene issue, there is a immunization problem. If we can do a survey that in the age of 0 to 5, how many of the kids have been really immunized as per the universal immunization program of our country, we can generate a very good data. Sanitation, infectious diseases are very common, like diarrhea, vector-borne diseases like malaria, dengue, chikungunya, Japanese encephalitis. These are another areas which are predominant in lower end. Look at the higher end area where metropolitan cities are high income group people. There is environmental health issues like COPD, lifestyle disorders like diabetes mellitus, hypertension, obesity, dyslipidemia, and non-communicable diseases also is one of the parts. So we have a wide range of these. Non-adherence to medicine, which is estimated to be up to 40%, 50%. So this can be one very good area of studies. So some good question areas are to establish the patient's actual use, understanding about the experience of taking his or her medication on time. Another question area could be identifying, discuss, and resolve poor or ineffective use of medicine by the patient. Then to identify side effect drug interaction that may affect patients' compliances, and to improve the clinical and cost effectiveness of prescribed medicine, thereby reducing the wastage of such drug. There is a very interesting domain this year. Pharmacoeconomics and genomics are working in these areas. In genomics, if we can identify the gene responsible and the mechanism of action of that drug, of course, we can work towards the precision medicine systems also these days. So these are very interesting areas. Now let's look at what exactly the social pharmacy and pharmacy practices. Social pharmacy is a discipline dealing with the role of medicines from the social aspects only. And pharmacy practice is a discipline involves developing the professional role of pharmacist. Similarly, pharmacy enterprise is also emerging area, which is an integrated system of business unit with accountability for clinical and financial outcomes related to medication use across the health system. And administrative pharmacy is a non-traditional role like business, leadership, and communication are just a few of the other skills needed for administration. So these are the emerging areas which we see. So pharmacy practice and social pharmacy are two important emerging research areas within the field of pharmaceutical sciences. This is our, I think, theme of this faculty development program. Combining natural science with social and humanistic research to study the role of medicine, patients, and pharmacists within the health care sector and society at large. So that is, we can really combine natural science with social science. Some of the important domains of clinical pharmacies are medication safety and policy, clinical pharmacokinetic and pharmacogenomics. While in social and administrative pharmacy, we have a pharmacy administration, pharmacoeconomics, epidemiology, and health policy and management. We have lot many areas in this. where we can really work. Health economics and pharmacoeconomics, health behavior and health education, consumer protection, health policy, law and regulation, regulatory science, epidemiology, pharmacy management, pharmacy informatics. These days, even digital therapeutics is an emerging areas. So we have not many domains to work. One very interesting such study, how to evaluate pharmacoeconomic data. The example of enoxaparin in acute coronary syndrome. So in one study, they compared the use of heparin and enoxaparin in treatment and their outcome after hospital stay and then follow up. So in acute coronary syndrome, they found that enoxaparin is more pharmacoeconomic when compared to administration of heparin. Similarly, in another study, they found that medication safety, a need to relook at double checking medicine. This was published by one nursing group where they found that single check system can increase the medication error. Why not to have a double check system of medicine at two different levels so that we can reduce the medication errors? So this is one area where at least you can reduce a patient suffering from a diabetes, having prescribed Dionil should not be given a Diavol or similar type of medication errors. They have been reported. So even in clinical practice, we see there are medicine information, quality assurance, technical services, medicine acquisition, purchase, management, information technology, research development, education, training, supply and dispensing. So these are another clinical areas. And if we see, even electronic health record itself can retrieve a number of data. A meaningful use of electronic health record can improve quality, safety, and efficiency and reduce health disparity, engage patients and family, improve care coordination and population and public health, maintaining the privacy and security of patient health information, and meaningful use compliances like better clinical outcome, improved health outcome, increased transparency and efficiency, and robust research data on health system. So that is also very useful in this research area. If we see community pharmacist, we have an accessible healthcare professional, clarifying misconceptions, screening patients for COVID, minor ailment consultation, monitoring and managing chronic diseases. Telehealth services are picking up area. Chronic medication renewal is one such area. So community pharmacist also can have very interesting publication on this area, like antibiotic dispensing practice in community pharmacies, a simulated client study. What a researcher did in Sri Lanka, they sent around 100 students to buy antibiotics from a retail outlet and compile the data and found that this much percentage of pharmacists dispensed azithromycin without prescription, tetracycline without prescription, amoxicillin without prescription, and they created, and this was published in a Science Direct journal. So these type of statistics findings are. Another very interesting, the attitude towards video communication for new medicine service at community pharmacies. If a community pharmacist these days, I think COVID days, there was a very difficulty in reaching to the shops. So video communication improved the compliances. So that is another beautiful studies in video communication, adopting this technology for alerting the basically patients on adherence of the medications or any side effect if it is coming out. Similarly, one interesting study which was conducted in Pakistan, the sale of WHO aware group of antibiotics without prescription. Antibiotics are classified into three groups: access, watch, and reserve. The simplest category is access, which can be dispensed; watch, which cannot be dispensed easily; and reserve, which is to be given in the later stages only, like the third generation cephalosporins and all that. So this on aware groups antibiotics. So they found that again in Springer.com it was published that how pharmacy practitioner or community pharmacists are dispensing without prescription. And I think these data would definitely sensitize community pharmacists, and we can reduce the antimicrobial resistance in our country. So Even pharmacist has a great role in controlling antimicrobial resistance beside lot many agencies working in these areas. I think thousands of agencies are working in these areas for prevention of microbial resistance. We can see even community pharmacists are involved in health screening also, glucose monitoring, opioid use disorders, assessing mental health assessment, dyslipidemia assessments, BP monitoring. So health screening is another such factor. I think on UG level, we can go ahead with such type of studies using community pharmacists in practice. Then medication therapy review. This is one of a very emerging area. Review the pharmacotherapy consultation, disease management, coaching and supporting, pharmacogenomics application, anticoagulation management, clinical services, medication safety surveillance, health wellness and public health, immunization. So these are the therapy management. So we can definitely look into how these therapies are managed. They are in order with the prescription or the directions, or there is a deviations? If there are a deviation, what are the differences in the outcomes? I think there are two different. One is a medication therapy review or management, and other is a therapeutic drug monitoring. That is also possible if someone is attached to an hospital, and they can do that study from a dialysis fluid also. Therapeutic drug monitoring, very simple. So some of the research questions which I would like you to know, that how do law influences development and approval of new drug products? What is the influence of newly developed product on health and health outcomes? How is a drug distribution carried out in countries and they have different education and availability of pharmacists? How do pharmacists perceive and act upon their expanded role in healthcare delivery? Why is the patient taking or not taking medicine as it was prescribed? What kinds of drug information has the best effect on patient understanding, and when should it be prescribed? How can a pharmacist most effectively identify a patient drug related problem or side effect? How can a new pharmaceutical services for the patients be implemented in healthcare? So these are some of the interesting areas. Why is the research of this type is so important? Because increasingly we recognize that pharmacy practice must be evidence based. I'm repeating this, evidence based. We do not have sufficient evidence in the Indian data. So the policy makers are not very much aware on this. So we must take use of best practices. Thus, it is important that pharmacy practices to be evaluated and the findings of such research to be implemented. It is important that pharmacy practitioners participate in collaborative social pharmacy research or undertake their own research and professional audits. So which is very essential to help policymakers to design their programs and policies. What topic require investigations in healthcare? Like supply, distribution, availability of services. Like we can conduct a very interesting study from where the vaccines move from the warehouses are importing after import, and how they reach to the end user, and are they stored in 2 to 8 degree, or they are equally potent or not potent. So supply, distribution and availability of services, demand of services, organization and process of service delivery, effectiveness and outcome of services, improve quality of services and quality assurance, evaluation of policy and practice, experiment and innovation, interface between pharmaceutical and health services, and payment and remuneration for services and pharmaceuticals. So the research is only the later, that is a systematic research and study, which we generate some data and then we put for publication. Topic of research should include outcome evaluation of drug products, programs and services, epidemiology, medication adherence, disease management, medication use policy, marketing, evaluation of educational paradigm that could impact practice and behavioral patient behavior, public health in context of pharmacy or medication use, clinical operations and quality, regulatory, informatics and financial aspects. Like Jan Aushadhi Kendras, they are giving generic medicines. So price differentiations are huge in branded and generic or of patent drugs. So that study can really help for the society. Interacting with patients and medication regimens get more and more complex these days. because of polytherapies. So educating them is another important areas. Some of the interesting topics which were published was prevalence and associated risk factor of iron deficiency without anemia among school adolescents. Urban rural differences in community willingness to isolate during COVID-19 pandemic. A very interesting publication very recently. So they assessed by observation how the urban people are behaving regarding isolation after COVID pandemic, and how rural people are behaving. What is their reaction on isolation, isolating themselves during COVID pandemic? Tackling the scaling up problem of digital health applications, like attention span in the students are gradually going down to 1 to 2 seconds by using mobiles. So these type of findings are there. Descriptive epidemiology of outdoors gym used in an Australian regional setting. An interesting paper was published. Outdoor gym. There are outdoor gym like simple exercise, naturopathy, yogas, and all that. They are using some outdoor activity. So how they are reducing the epidemiology. Patient evaluation of asthma counseling, quality in primary healthcare. This is very interesting because many of the patient in our country, they are using asthma medicine, respiratory medicine like meter dose inhalers. They're using dry powder inhalers, DPIs, MDIs, rotahalers, nebulizers. They are using extensively for children. But many of the patients doesn't know what is the correct use of meter dose inhaler, yeah, dry powder inhaler, or nebulizers. So helping them to understand what is the correct use of those devices, or how to instill eye drop correctly, how to instill ear drop correctly. These are another area of studies where we can educate and counsel the public. Financial burden of heart failure in our developing countries, like cost analysis from the registers of that is an historical data. If some hospital is ready to part that information, we can really, our insurance agency is able to part that information collectively. We can publish that financial burden in different setups. So if we look at the bench to bedside research, which bench can be our laboratory bench, a research bench, pilot studies, scale up studies, so is used to describe the process by which the result of research done in the laboratory are directly used to develop new way to treat patients. Pharmaceutical care is direct responsible provision of medication related care for the purpose of achieving definite outcomes that improve patients' quality of life. Similarly, pharmaceutical care, the patient care is a service rendered by members of the healthcare professional for the benefit of patient. So in patient care and pharmaceutical care, bench to bedside research is very essential, and this is very important. But I appreciate we are doing research, but we are doing most of the research in drug discovery, drug development, herbal, polyherbal, nano, formulation, delivery. But many a time our UG, PG, they are not able to carry forward that research up to the level of commercialization of that research. So a lot of resources are being wasted there. And I think until unless we are not able to generate some lead molecule or some study which can be commercialized, and if we do it really in a commercial setups, then of course we are generating some resources, we are helping the societies. If thousands of such UG, PG scholars are doing that research and it is just packed into the dissertations only, and they are not ultimately in use, I think huge time resources and financial resources are wasted in this direction. So drugs, even drugs that make it from bench to bedside, may still face difficulties when phase 4 trials are done. So we have seen even phase 1, 2 trials are over, third is over, there is a marketing of that particular drug, but when it comes to post-marketing surveillance, we see that even there they produce side effects. And we have a very huge program, pharmacovigilance program of India by IPC and CDSCO. So that programs we found, and that they give directions. And one such example is the banning of rofecoxib and valdecoxib, one COX-2 inhibitor in this findings. So ultimately, we are not very sure of developing and discoveries of that area. So ultimately, I arrived to one such conclusion that as a faculty member, as a researcher, I think we have different roles to play. We have an individual role to play in personal counseling and health persuasion. We have an authoritative role to play in health persuasion. We have a role as a collective role to play in legislative action, like implementation of the regulations and law and their interventions. We have role to play as a negotiated role in personal counseling, as in 1:1, or in community development, focusing with interventions. So ultimately, medicine use reviews are very important. Until unless we will not review the medicine use, so we cannot really understand the unmet needs of the patients, society, social pharmacy, or pharmacy practice areas. So in last, we must adopt a practice which is a healthy practice of medicine use revision practices. So medicine use revision practices will help our faculty members and of course researchers to generate sufficient data which can help the authorities and policymakers to make a better national health programs and all this. With this, I really thank all for really listening patiently to these deliberations. The topic, I am sure I could sensitize, I justified the time you have given to me. Thank you. Over to you, Dr. Ashwini.
Thank you so much, sir.
Thank you, Prerna.
Sir, you very well explained and nice presentation. You clear the all key concept of the pharmacy and research, and you focus about the all the community of the maybe pharmacist or maybe research methodology. Sir, very well explained. Very informative session, sir. Thank you so much, sir.
Thank you, Prerna. Thank you very much. I hope
now
I could sensitize.
Okay, thank you so much, sir. Now I would like to invite Dr. Priyanka Kriplani for vote of thanks.
Thank you very much, sir. It was wonderful listening to you. And the main point which I think was that we should opt in our institutions is that the thing which we are discovering or we are working upon, it should be based upon commercialization, basically.
Of course, society benefit. Yes.
We are working hard in our institutions also, and the students are also doing work. But the thing is that we are not thinking about that. We are just doing the work, but we should think about that whatever we are putting the efforts, it should be commercialized, or it should be as per the real life problem. It should be based on solving the real life problems. So thank you very much,
otherwise,
sir.
Otherwise a lot of resource wastage is doing.
Yes, sir. Thank you very much, sir. And as a
Thank
token of appreciation, sir, we would also like to present a certificate to you. So it will be on the screen.
Thank you very much. All.
Thank you.
Thank you so much.
Thank you, sir, for your wonderful session.
Thanks a lot.
Thank you, Ashwini. I hope I could justify my time.
Yes, yeah. Sir, basically pharmacy is a practical oriented course, and as a faculty member, it's our duty to impart specific skills related to research, manufacturing, quality audits, and regulations. And I think your lecture provide an overview about all the things you have covered, all the related to research, related to regulations, and prominent area that have to be explored while carrying out the research in future. Thank you, sir.
Thank you very much, Ashwini.
Also, we also think your kind cooperation will continue with us, sir. Thank you, sir.
Always, always, always. I told you that I love Yamunanagar because I am born in that area.
Thank you, sir.
Thanks a lot, sir.
Thank you, sir.
Thank you very much to one and all. Thank you very much. Great.
Dear participant, the next session will be at 11:30.